People who want health care that starts January 1st have until Monday to enroll through Covered California, the state-run exchange under President Obama's health care law. Joining me to talk about the pace of enrollment in San Diego County are Covered California spokeswoman Lizelda Lopez and Gary Rotto of the Council of Community Clinics San Diego. Lizelda, let's start with you. How many people in San Diego County so far have enrolled in Covered California?
We have about 10,000 people in San Diego that have enrolled and picked a plan, so SHARP or whatever plan they've chosen, from October and November, which is a really good number compared to, we're at about 9% of the total enrollments for the state, which is more than what we expected.
And of the people who've signed up, how many are eligible for federal subsidies?
About half of those are eligible for federal subsidies, so we feel very encouraged that we have the right mix of people enrolling.
And for people who sign up before the December 23rd deadline, till when do they have to pay their premiums?
The date to pay the premium is January 6th. So if you pay your premium by the 6th, then your coverage is effective January 1.
Gary, let's move on to you. What are clinics in San Diego doing to prepare for the expected influx of patients in January?
Well, we had been very fortunate in that there were grants that were available, both federal grants as well as foundation funds that have been available for the clinics to expand their services and add new services and even add new sites. So we've been doing this, working on this for several years. We've also been implementing a patient-centered medical home model, which really works in total with the patient, not just the physician, but all the other folks that are part of that medical team. So redesigning our systems, both internally and externally, being ready for patients, more patients to come to us. Some are already coming to us that will receive coverage, but there will be many that will be coming to us with coverage for the first time.
So have additional sites been added?
They have. I mean, I think of the new site that San Ysidro Health Center has on Euclid. I think of the new site that that Vista had completed not too long ago, and there are several others around the county as well. We've been very fortunate that our clinics have been so competitive in the grant funding process.
So overall, you guys are prepared?
We believe so. We're looking forward to this.
Now, let's talk about Latinos. They were expected to be a linchpin under this health care law. Many of them are young, and yet they have not signed up in the numbers that were expected. Why is that?
I think the Latinos need to make, it's a family decision, so they all want to have that conversation and figure out what is best for the family, what is best for them in their unique circumstances. We're asking them to make very difficult decisions as well, and sometimes they need help with filling out those applications, so we need them to know that there is local help available. Gary and his group are a perfect example of that. If you need to talk to someone one-on-one and really just understand what does this mean for me and my family, they can do so, and now we have a lot more options for them to do that. Before we had the website and the service center, but we didn't really have the community network that we needed to support a good number of people with those questions that wanted the face-to-face. So now on our website we have a section that says find help near you. You can get an enrollment counselor to help you, or a certified insurance agent, or even the County Human Services Agency to help you just one-on-one, face-to-face, fill out that application.
And Gary, what kind of help are clinics offering?
Well, it's this face-to-face. It's being able to walk people through the process, no matter what language they speak, whether they're comfortable in English or they're more comfortable in their native tongue. We have people that have different types of experience and can work with people with the application, with what their needs are. Often asked, who is my provider with? What health plan? And we can help walk them through that, because that's a key question that many people have. I like my doctor. I like where I go. How do I make sure that I can stay here with my clinic? Which plan should I pick that would allow me to do that? And which one really provides the coverage that I need, knowing that my daughter has asthma and I'm going to need to see you for a certain number of care visits. And we want to make sure to cover that and that it's cost effective and help to walk them through the many different options they have for the first time.
And already, though, are some Latinos coming in and consulting in that way?
Absolutely, many. And even in some of the outreach programs that we've had people calling in for information, and then we're making appointments for them because they want to come in. They say, I feel more comfortable if I could sit down and talk with you and you can walk me through this.
Okay, Lizelda, very quickly, I understand that there is not yet a Spanish application available on the website. When might that change?
We expect it to be ready either I think it's this week, if not early next week. We know that the application, having the Spanish application is important, but I think at the end of the day, people really have some questions, and just the application on its own is not going to be sufficient. So we are super grateful to our partners for being able to walk people through that.
Okay, we have to close it there. Lizelda, Gary, thanks for coming on the program. For more information about enrollment, you can log on to our website, kpbs.org/secondopinion.